Hello everyone, this is the C part of first aid, and in this session we are going to study about the first aid for fractures. So children, before going into the first aid for fractures, we must know what is a fracture. Actually children, a fracture means a crack in a bone. When there is a crack in the bone, that is known as a fracture. So, a fracture is a cracked or broken bone. When the bone is broken or there is a crack in the bone, that is known as a fracture. The treatment of all fractures is same. The affected part of the body should be immobilized and the patient made as comfortable as possible. Patient should be given nothing to eat or drink. Suppose children, somebody has got fracture. So children, the affected part or the fractured part of the body should be immobilized. Immobilized means it should not be moved. That part, the affected part or the fractured part should not be moved. And the patient made as comfortable as possible. And we should make the patient to lie down in a very comfortable position. Patient should be given nothing to eat or drink. We should not give the patient anything to eat or drink. If the damage is so great that the limbs involved is distorted. Distorted means has changed its shape or twisted. That means the shape of the limbs has changed. Out of all normal recognition, it may be necessary to straighten it. Suppose children, the part of the body or the part of the any part of the body, that is limbs or legs, if it is fractured or not fractured, if it is distorted means it has become out of shape, that should be brought to its normal position by straightening it. That is very, very important. That means that distorted shape should be straightened. This may be difficult and will certainly be painful. See, to bring the distorted limb to its original position is very, very painful. But it may help to save the limb. And see children, if we want to save that limb or any other part of the body whose shape has changed or who is distorted, twisted, has become out of shape, that should be brought to its normal position. So in doing so, this process is very, very painful, but it will help to save the particular limb. Obviously, this should only ever be used as a very last resort and not at all if there is a chance of skilled medical help arriving. See children, before doing this, before straightening it is we have to be very careful, and this should be the last resort. If there is no medical help, only then we should try this. And so if the medical help is arriving, then we should not do this. There are three main kinds of fracture. Now there are three main kinds of fractures. Fractures are of three kinds. Closed fractures in which the skin is unbroken. So first type is closed fracture in which the skin is not broken. Skin is not broken, that means only the bone is broken. Although it may be heavily bruised. Heavily bruised means the skin has become, that portion has become, we can say bluish red. That is known as the bruised skin or the bruised. So the skin is not broken, only the color of the skin has changed to bluish black and the bone is broken, the closed fractures. Closed fractures can be complicated when blood vessels, nerves or organs near the break are also severely damaged. So in closed fractures, what happens? It is very complicated and all the blood vessels, nerves or organs near them, that is broken. Now see, closed fractures means around that fractured area, all the organs which are near to that may get damaged. Suppose a rib is broken. When the rib is broken, what happens? It will puncture the, after breaking, it will puncture the lungs, or it will penetrate into the lungs. So fracture is there, and with that fracture, the organs and the blood vessels which are surrounding to that area also gets damaged. That is known as a closed fracture. Such as when a broken rib penetrates a lung, or they can be simple when there is little damage to the surrounding body tissues. It is complicated when it damages the surrounding organs and blood vessels, and the fracture may be simple. Another type is simple type of fracture, so that that when there is a little damage, not much damage is there to the surrounding body tissues. When little damage is there, it is known as a simple fracture. When much of the organs, surrounding organs, blood vessels are damaged, that fracture is known as a closed fracture, or we can call it as a complicated fracture. Now next type is compound fracture. Compound or open fractures in which a bone protrudes through the skin. Protrudes means the bone comes out of the skin. It is extended beyond its limit. That means it comes out of the skin. That is known as a compound or open fracture. Through the skin, or there is a deep cut leading down to the break, allowing germs to enter. See, either there is a deep cut so that the bone breaks, or the bone comes out of the skin. That is known as a compound fracture or a open fracture. And when there is a deep cut and the bone breaks, then there is a chance of the germs entering that part or entering the wound. The third type are the Greenstick fractures, in which the bone bends and half breaks. Greenstick fractures. This is the third type of fracture. Greenstick fracture. What happens in the Greenstick fracture, children? The bone bends. The bone bends and half breaks. Full bone is not broken. Only half of the bone is broken. It is most common in children, and this type of fracture is common in children. See, here are the different types of fractures shown. See here. This is the simple type of fracture. This is a compound fracture. You can see here. And this is the third type, that is a Greenstick fracture. Here the bone is bent and then it is broken. So this type is known as a Greenstick fracture. Now, first aid for fractures. What you have to do for to give the first aid? Treat a suspected fracture carefully and move the affected area as little as possible while making the patient comfortable. Gently remove clothing from any open wound over the break. See, children, the first thing is that when somebody has got a fracture, don't try to move that person. Or if you have to move that person, you should be very careful that he or she should not be moved too much to make the person comfortable. Then if anything is there on the wound, that should be removed, any clothing. Secondly is that cover the wound with a clean piece of lint and place a gauze or a ring pad over the protruding bone. Alternatively, pack over the wound using a matchbox pocket. Now, if children, it is if the bone has protruded out, what you have to do? You have to cover the wound with a piece of lint and keep a pack over that wound. Then third point, bandage the wound supporting the injured part carefully. Then you have to bandage that wound. The ring pad or the packing will reduce the pressure on the open fracture if applied too tightly, the bandage will interfere with the circulation. So whatever bandaging you are doing, that should be not too tight so that it will interfere with the blood circulation. Immobilize the fracture. If the break is in a leg, use the uninjured leg as a splint by tying it to the other leg with bandages at the knees and ankles and around the feet, pad between the legs. See, if there is a fracture in the leg, here is the fracture. You can see in this figure, here is the fracture, and the leg which is uninjured is used as a splint or as a support, and these two, the injured leg and the uninjured leg, they are tied together, and this uninjured leg is used as a splint or support to the other. So this is the first aid. In this way you can give the first aid to the first aid for fainting or unconsciousness. Fainting means when the person becomes unconscious. Fainting is a loss of consciousness, usually accompanied by a loss of color in the skin. You have seen when a person becomes unconscious. In your school, you have seen during the assembly time, many children, they become unconscious and they fell down. And when you will see the color of their skin, it becomes the skin color turns pale. So that is known as fainting, or it is also known as unconsciousness. Although a faint occurs suddenly, it is often preceded by feelings of lightheadedness and nausea. See, we never know when we will faint because it appears suddenly, or we can say it occurs suddenly. And before that, we have a feeling of nausea. We feel like vomiting. Fainting is twice as common in women as in men and peaks in the teens and during pregnancy. So fainting is more common in the ladies or in the women and in the teenage children. Faints in older people may be a sign of serious disease. If any older people, or we can say the elders, if they are fainting, that means that is a sign of some serious disease. So they should go to the doctor for a thorough checkup. Now, what are the causes of fainting? Fainting is the body's response to a reduction in blood. See, when fainting occurs, when there is a reduction in the blood supply and therefore oxygen to the brain. See, if there is less supply of blood, there will be less supply of oxygen because blood is the carrier of oxygen. So in fainting, what happens? There is a reduction in blood and therefore oxygen to the brain. So the amount of oxygen which should reach the brain is not reaching. Therefore, the person becomes unconscious. The brain uses the faint to bring the head down to the level of the heart to make the best use of the available blood. You children, you have seen when anybody faints, it drops his head to one side or towards the heart. It happens so that the body can make the best use of the available blood. So there is a less supply of blood, less supply of oxygen. That is why the person is fainting and it droops its heads towards the level of the heart to make the best supply of the available supply of the blood. The reduction in the flow of blood to the brain may be due to sudden blood loss, either internal or external. Now, how there is a reduction in the blood supply? Why there is a reduction? This may be due to some internal or external blood loss, maybe due to some accident, internal bleeding, or some external bleeding. The brain responds in exactly the same way if blood pressure drops for a reason other than the blood loss. So one reason or one cause is the loss of blood. The another one, it may be the drop in the blood pressure. The blood pressure becomes low. In that case also the person faints. So you have seen the cause. One cause is that less supply of the blood, and because of that low oxygen supply to the brain, and this is the first cause of this unconsciousness. Second one may be internal or external bleeding, or there may be low blood pressure. So all these are the causes of faint. Many people faint at the sight of blood. Some people faint when they see any person who is bleeding, or any injury. If they see, they faint. In extreme cases, even at the sight of other people's injury. See, some of you faint when if we see any blood, any person bleeding, or anyone get injured, then also the person faints. This is because the body's mechanism see the blood loss and assume that it is going to reduce the amount of oxygen to the brain. So there is a reason why the people faint after seeing the blood, other person bleeding, or seeing its own body bleeding, or by seeing any injury. This is because they think that the blood loss will reduce the amount of oxygen reaching the brain, and then they faint. So these are the reasons of fainting. Now, blood pressure as well as psychological factors. Faint may be due to low blood pressure. See, this is a psychological factor. When the blood pressure drops, the patient faints. This is especially true of the elderly patient on treatment for high blood pressure. Most blood pressure drugs work by slowing the heart and pooling blood in the legs. See, some people suffer from high blood pressure. When they suffer from high blood pressure, so they take some medicines or drugs, and that medicines or that drugs work by slowing the heart and pooling blood in the legs, and by taking that it reduces the blood pressure and all the blood pools into the legs. When the patient rises from bed, not enough blood and hence not enough oxygen gets to the brain, and a faint follows. See, the person is having high blood pressure. He or she has taken some medicine, and due to that medicine the blood pressure has gone down and all the blood has pooled into the legs. And when the patient tries to rise up from the bed, because of not enough blood and not enough oxygen reaching the brain, the patient may faint. Doctors encourage sufferers to get up slowly and to leave at least a minute between sitting up and standing up. So such persons, those who have taken the medicine to lower their blood pressures, so they should not get up immediately from the bed. They should first sit on the bed for a minute and then they should stand up. So this will help them in normalizing their blood pressure. Now, another one is, see here, if somebody has got this choking problems, what you should do. This is simply I am telling you, see what treatment, first aid during choking. When somebody gets choked, there is no doubt that choking is quite terrifying for both children and adults. It may be due to a piece of food, a small toy, or some inhaled some inhaled vomit, but the result and the treatment required are the same. Sometimes this choking may occur when there is a piece of food, somebody has swallowed that piece of food in the windpipe, or a small toy, or sometimes we inhale vomit also. At that times choking occurs. So what you should do? Treatment. Firstly, don't waste time trying to pick the object out of the throat, as it will probably be too slippery and you might well push it further down. So we should not try to take out whatever is there in the throat. We should not try to take out from the throat. If in doing so, what will happen? We will push that, being slippery, it will push down into the throat. To clear a baby's or a small child's throat, turn them upside down, holding them firmly by the legs, and slap them smartly between the shoulder blades. Now see, if some child is choking, what you should do? We should lift the child upside down. We should hold the child by its leg, and this mouth or the face should be towards the ground, and then we should slap them on the shoulder blade. This is the shoulder blade. This one at the back, this one, these are the shoulder blades. We should slap them on the shoulder blades. The object should come shooting out, but if it doesn't, try again. So in doing so, the object, whatever is whatever is the cause of choking, will come out, and if it doesn't come out, repeat it twice or thrice. Now, if this hasn't worked and the child is quite obviously choking to death, then try giving their stomach a short, sharp squeeze. And again, if this is not coming out, if this process is not working, so what you should do? You should try to give choking to death, then try giving their stomach a short, sharp squeeze. Then you should squeeze the stomach of the child. For any bigger children or adults, bend them forward over the arms of a chair. We should bend them over the arms of the chair. So here this child you have seen she has bent them forward on its knees. You can see here. So if the child is bigger, we should use an armchair, and we should bend them forward over the armchairs and give them 2 hard thumbs between the shoulder blades. Try this 4 to 5 times. So we can use this instead of this bending on the knees. We can bend them on the arms of the chair, and we can give thumbs here on the shoulder blades. So in this way, we can help the person, or we can give first aid to the person who is choking. Now, first aid during the sprain. Sprain means moch. A sprain is an injury to a joint involving damage to the ligaments around it. So what is a sprain? Sprain is actually an injury of the joint and involving damage to the ligaments. See, joints, 2 bones are joined together with the help of the ligaments. So in the sprain, the joint is injured and the ligaments around it is also injured. So that is known as a sprain. This type of injury is result of a sudden forceful movement, such as turning the sole of the foot inward so that the weight of the body is implaced onto the side of the foot or the ankle. Suppose while walking in a hurry-worry, or there is placement of the foot or the ankle, we can say, and we suffer from sprain. The force causes a sudden sharp pain followed by swelling. So when there is any sprain, there is always a swelling. The joint cannot be moved without causing further pain, and we are unable to move our joint. Treatment involves rest to give the ligaments a chance to repair themselves, and a cold compress to reduce the swelling. When there is swelling due to sprain, children, what you have to do? See, you should give rest to that part. where you have sprain, and you can use a cold pack, ice pack on that swelling. Bandaging will help to support the ankle while it heals. It is advisable to consult a doctor who may suggest an X-ray to eliminate the possibility of a fracture. Sometimes there may be a fracture, so you have to consult a doctor, and you may have to take an X-ray also. Once the joint is free of the acute pain, it must be exercised gently in order to restore the mobility. So once this joint is free from pain, then you can go for a physiotherapy. You can do some exercise to restore the mobility of the joint. So children, here we end this session, and in the next session, that will be the D part. In that we will do the different types of first aids which you will follow, which you will keep in mind while giving first aid to the person. That will be the last part of this chapter. Thank you.